Researchers from Case Western Reserve School of Medicine have found some advantages for those who received the Moderna vaccine and not the one from Pfizer. That study was published today in the Journal of the American Medical Association. News 5's Olivia Fecto tells us those differences showed up for both breakthrough infections and hospitalizations.
I want to emphasize that these are both very effective vaccines.
Dr. Pamela Davis, one of the study's co-authors, says at first the data appeared to show people who were sicker were those who had received the Moderna vaccine rather than the Pfizer one. But after adjusting for factors such as age, sex, race, and other illnesses, that was no longer the case.
So among infected people, Moderna vaccine recipients, they are also less likely to be hospitalized compared to people who received the Pfizer vaccine.
The study analyzed records from more than 637,000 fully vaccinated patients from 63 healthcare organizations across the U.S. The data came from July through November 2021. The study excluded people with previous COVID-19 infections or those who had already received a booster. Overall, results showed more breakthrough infections and hospitalizations for Pfizer vaccine recipients than for Moderna, but there was no statistically significant difference in mortality rates.
Young, healthy people who are at low risk anyways, I think this just shows that it probably doesn't matter which vaccine that you get. Certainly, if you're higher risk, would you maybe want that extra smidge of protection that Moderna gave?
University Hospital's pediatric infectious disease specialist, Dr. Amy Edwards, agrees with the researchers, saying it's not surprising Moderna was a little more effective, since it has a higher amount of mRNA per dose. They all agree both vaccines are effective, but they caution these results don't tell us anything about Omicron.
There is a higher risk of being in the hospital from Delta if you have had the Pfizer vaccine, but we're not in the Delta phase anymore.
Still, Davis thinks this gives both the public and physicians a bit more information to consider.
Although there have been a lot of rumors and anecdotal information, I think it's important to go to real data in real people.
The researchers hope to do a follow-up study to see if the vaccines showed any differences in Omicron patients. Olivia Fecto, News 5.